All right, let's call this meeting to order. Can I get a motion, please, that the agenda for the April 16th, 2019 special meeting of council be adopted as presented? Councillor Sorensen, Deputy Mayor Sorensen will make that motion.
And Captain.
Any questions, comments, or concerns? Hearing none. All those in favor? Motion carried. And before we get into our delegation, I'd like to welcome our brand new intern, Mike. Or we can call, I don't know, we got to come up with a better nickname. There's too many mics. So
we're working
welcome
on it,
aboard.
Your Worship.
Our new municipal intern, so welcome to Edson.
Thank you, Your Worship.
Thank you. All right, we're going to move on to our delegations. Can we welcome our delegation here tonight? If you would like to take a moment to introduce yourselves to talk about the medically at-risk driving program.
Sure.
Okay.
So I'm Bonnie Dobbs. I'm director of the Medically at-Risk Driver Center, and I'm a professor in the Department of Family Medicine. And a lot of the research that I do is on the impact of medical conditions on driving. And one of the populations that I was particularly interested in was people with dementia. So anyone with a disease such as Alzheimer's disease, it's not if, but when they will need to transition from behind the wheel to the passenger seat. One of the things that was just a profound learning for me is that physicians often don't want to deal with individuals with dementia and their driving, because once they revoke their license, how do they get around? And that led me to the program of research that I'm heavily invested in now, is in terms of getting alternate transportation in our communities. Because we know that what precludes people from being behind the wheel not only prevents them from using their own vehicle, but often precludes them from using public transportation. So we need some kind of mobility system outside of the public system in order to allow not only people with dementia, but many seniors with medical conditions to be able to age in place, and that's through enhancing their safety and mobility through alternate transportation programs. And one of the projects that we've been working on, and we'll talk about a bit in a minute, is our collaborative work with the West Yellowhead Group in terms of trying to get more responsive forms of transportation available for your seniors in this area. So thank you.
Excellent.
And I would also like to invite the other two from our working group. They've been a really big part of it, so if you wouldn't mind introducing yourselves.
Sure. I'm Sung Ho Yun. I'm an occupational therapist at Edson Medical Center, Edson Healthcare Center. And part of my role is to actually assess clients, senior clients, and their ability in driving. And often I'm the one who's recommending whether they are still quite capable of driving, or sometimes I have to send a letter to doctors to make a very hard decision to revoke their driver's licenses. So particularly this is a very interested area for me. That's why I joined this group and try to find some solution for our seniors in this community.
I'm Maggie Gibbons. I'm the registered nurse at the Primary Care Network. I do chronic disease management, and I have started doing seniors population health. So I see people who are not connected with other services, so they don't have home care or they're not involved with the nursing home, that sort of thing. So seniors in the community at large. And I do assessments and referrals as needed for them.
Excellent. All right, well, welcome, and if you want to get into your presentation.
Sure, thank you. Okay. So if we could do the next slide.
Okay.
So in terms of the transportation mobility of seniors, I think that we have a pretty good understanding of what those unmet transportation needs are at a national level. But one of the things that we were interested in knowing was what do the data look like for our seniors in the province of Alberta. So we contracted out to Bannister Research, and we conducted a provincial transportation needs assessment of seniors and persons with disabilities in 2016-2017. And we did phone interviews, or Bannister did phone interviews with over 1,500 individuals, so primarily senior drivers and senior non-drivers and persons with disabilities. And you can see from the overhead that we had over 1,000 senior drivers and close to 400 senior non-drivers. So the data that I'm going to present tonight are based on the senior drivers and non-drivers. And one of the things that we were interested in is comparing the difference in the unmet transportation needs between those two segments of the population. And I'm just going to present a little bit of the data. All of the reports that we have on the unmet transportation needs of seniors in the province, there's reports based on are available on our website. So we've analyzed the data at a provincial level, and we've also analyzed the data for each of the AHS zones. So if you want to understand or know what the unmet transportation needs of seniors are in your area, you can go on to our website and access that report. But overall, one of the things that we did is we looked at the different types of trips that seniors need to take. So medical appointments to essential services and to recreational leisure and religious activities. And we know, and I think everybody in the room knows, that in terms of transportation needs, most often both the senior and the family put a priority on the medical transportation. So if mom or dad have an appointment, a medical appointment in the city, or if they have a diagnostic test, someone makes themselves available to take them to that appointment or to the testing. The other needs often go unmet because a family member can say, Mom, I can take time off from work to take you into Edmonton to see the retinopathy clinic, but I can't take time off to take you to the bingo or to the social events. And at the end of the day, it's those types of transportation activities or rides to those types of activities that really enhance the quality of life and well-being. So it's not surprising when you look at our data. So for the senior driver in our sample, 17%, almost 1 in 5 seniors were unable to get to medical appointments because they did not have a ride in the last 6 months. And then when you look at getting out to the grocery store, getting to the pharmacy, and you can see that almost a third, so 27% of senior non-drivers said that they didn't get to essential services because they didn't have a ride. And then the recreational leisure, religious activities, over a third of the senior non-drivers indicated that they were unable to get to those types of activities sometimes or often. The other data that I think are also really compelling is even the senior drivers, and it's a smaller percent. But when you look at less than 6%, 7% of seniors that aren't getting out into their community because they don't have a ride, even when they drive, that's pretty impactful. One of the things that we've done over the years at MART is we've started working, so recognizing that our seniors have unmet transportation needs, and particularly in rural and remote areas, and understanding that there isn't a good infrastructure in place to enable communities to develop these services. We've been doing pilot projects with many of the rural and remote communities, or a number of rural and remote communities in the province. A lot of our funding comes from the Ministry of Seniors and Housing. So the first community that we worked with in 2013 was Wainwright and District. They launched their service on August 6, 2013, and they had gone out and fundraised, and they bought a handy van, and then they inherited an old bus from the town. And they started off by giving 20 rides a month to seniors in their area. They are now giving anywhere from 200 to 250 to 300 rides a month. They went from having a handy van with a part-time driver to having 2 new handy vans. They have a full-time paid driver, a part-time driver, and they've also added on what I would call, in a blended model, they have volunteer drivers. So their paid drivers are responsible primarily for the medical transportation into the urban areas, and then the volunteer drivers take care of the other trips in and around Wainwright. So that's been just an enormously successful model. And most of the funding for this service and for many of the alternate transportation services is they're a not-for-profit company, and they fundraise. They also do get some funding from their council and from their municipality to sustain the program, but it's a lower percent. We also worked with Wetaskiwin in terms of creating efficiencies in the delivery of rides. They have a big debt service, and so we looked at using ride scheduling software to increase efficiencies. We've worked with Pincher Creek. They had just a very fragmented service, and they now have rural service. They bought 2 handy vans. They've hired drivers, and then they also have volunteer drivers that take their patients or their senior citizens into Medicine Hat and Lethbridge for medical appointments, and to Claresholm and to Calgary. We just finished working with Big Lakes, which is a remote area, and you can well imagine how difficult transportation is in those areas. And they've implemented a model. They bought a brand new 16-passenger handy van. They have a full-time driver or a part-time driver, and they've developed fixed routes, and then they have the bus for social outings. And we've just finished working, or just in the process of finishing working for a year with the West Yellowhead region and also the Sturgeon region. And what we've done over the years in working with all these communities is we learn from each of the projects, and we share our learnings, and we're starting to build a community of practice for alternate transportation service providers throughout the province. And it's been an absolute delight working with the West Yellowhead group. It's been just a fantastic collaboration. So turn it over to you to talk about the work with them.
Okay, thank you, Bonnie. So over about the past year, I have to credit Song actually for making the first phone call to me saying, you know, this is a real problem that I'm finding with my patients, and we need to do something about it. After that is when this MARD project came to be, and so there was the opportunity for us to apply for a small grant to help us come together and work together as a group. So it's really been a combination of, in the West Yellowhead region, it's us, Yellowhead County, Hinton, and Jasper that have been coming together on a monthly basis. And each one of us sort of has our own unique bus system within our own communities. Some are maybe more functional than others, but everybody has barriers, definitely. And so we did go together. We had a large community meeting that happened at the hospital, and we actually had a really good a group of individuals come from across West Yellowhead, and from there we decided to apply for this and move forward. In moving forward, we found that the table that we had going, there was really just too many there to do this focused work. So it ended up being really kind of the FCSS groups, and then we invited participation from the local transportation and also the medical professionals that also joined us. And we've kind of been the longest standing members, I guess, and very committed to it. So once we were awarded and that work took place, we met, like I said, on a monthly basis. And we, as much as we're different, we have a lot of the same challenges. And in Hinton, I guess I kind of went through this already as to who's been part of it. I don't know if you guys need me to really read through all that. You can take a look. And really just working together as partners, what we've come up with to this point is that the Sundog is a bus service that has been running for years already. Typically, it's been more so to do the run to the airport. I think one of the major issues is that it really hasn't been promoted or marketed very well. So there's a lot in our community that don't actually know that they can get on this bus and go to the city on a daily basis and return home. But adding to that is it's not accessible. So if you are in a wheelchair, unless you're able to actually take someone with you and get out of it and be helped onto the bus and fold your wheelchair, it's not an option for you. That being said, Sundog ownership has really amazed myself and I think the entire group in that they provide a discounted rate so from Edson, I think it's that the rates and whatnot are in here, but yeah, it's like $80 to go to the city and back. But they not only provide the transportation, they drop everyone off at West Edmonton Mall, but they actually have a vehicle waiting there for them. A taxi will take them to their next appointment. And then they also arrange from that specialist appointment back to the meeting spot at West Ed. So you don't have a senior getting off and being, you know, really frantic at West Ed trying to phone a cab and trying to find who they called. And they've trained their drivers really nicely too to help them off the bus and directly into the vehicle that they're going into. So you know, it's not only discounted and they're, although it's kind of a win-win situation because these patients will help fill their bus and make their trips more feasible. But at the same time, they're doing it at a discount and they're doing it because they just, out of really the goodness of their hearts.
And that taxi is free, right? Like that's all arranged
Yeah.
in that one fee that you pay. You don't, the senior doesn't have to then pay the taxi driver at all. That's all in that one fee.
Yeah, and it's all organized for them. So this is the service at this point that we've come up with. But one of the struggles that we're finding in all communities is what we're calling the first mile, last mile problem. And so how does one get from their household to the Sundog drop-off point, and then when they come back at 6:30 at night, how do they get back to their house? In some cases, family members, it's a lot easier to make that trip than go all the way into Edmonton and back, so people are taken care of. But there are individuals that can't. And so the three of us actually met with ESTS recently to talk about the first mile, last mile. There was resistance to adding services, but they did agree to go back and speak to their board about it and get back to us. I think too, I know we're talking a lot about the medically at risk part of things, but on top of that, I think the need to extend services in Edson is greater with isolation and getting to the basic needs and whatnot. Do you guys want to talk a little bit about what you're hearing from your patients?
Sure. So basically, transportation is very much involved people's quality of life. Like Bonnie just explained a little bit. Whatever they need to do in their life, not only they are doing things in their household, but they have to reach other places. At the moment, especially as an occupational therapist, I work with those people, how they carry on their life. And I've been working with many people, seniors who's isolated in their own household, does not have means to get out from their household to achieve their basic needs, like going to grocery shopping or getting to their medical appointments to hospitals or doctor's appointments, or even going to meet their family members without getting their other people's help. So those people are more isolated, like as time goes, and then their health in general is decreased, in a fast phases. And you will see your next door neighbor who was really mobile, and once they have a little bit of medical condition like a stroke or starting dementia, and then their health condition drops like dramatically. It shouldn't be, because they can still continue their life with those little bit of disabilities if there's accessibility available for them. But at this moment, we are looking at a lot of difficulties due to lack of those accessibility for those people. We have identified the Sundog as inter-community transportation, which is great, because we were desperate initially. When we first started, we were not aware of those services. We thought there's no inter-community transportation. There was a Greyhound. Unfortunately, they have pulled their business back. And then it is commercial model, and I could never find their travel schedules even. Like I can't do that. And then considering those seniors trying to find those schedules and getting to those points was almost impossible for me to expect them to do that kind of work. now we have identified inter-community transportation, and then Tanya was mentioning about first mile and last mile, which is intra-community, like within our town. I still find there's a lot of people having difficulties from point A to point B, from their home to, let's say, doctor's appointment. That's the main thing. Because many seniors have kind of regular doctor's visit, but they miss a lot of doctor's visit. And then I have been having a lot of missed appointment. Now I was wondering why. Is it because the healthcare is free, but the people just don't care to come? And I've started realizing that it was not their intention. Sometimes they just couldn't afford to come because they have no means to come. That was the main reason that I've been being involved with this group, and then try to make this problem being aware by many other people, so they can actually stand up and find some solution for these seniors.
Maggie, anything?
Sure. So I work directly with social workers in town, and a lot of my patients see the social worker, see a lot of different people in Edson, and I find that we do have a seniors bus, and the service that they provide is great, but there's still gaps in the service that they provide. And we have, like, for example, someone will have an appointment at our office, and they have to show up an hour early because that's when the bus can drop them off, right? So then they come, and this lady knows, so she's prepared, she brings a book, she sits there, reads, not a big deal. However, like, now her, half an hour appointment has now turned into a 2 to 3 hour appointment because the bus is maybe at overcapacity, like the seniors bus, right? Like, it's very hard to get a hold of someone to get on there to schedule your ride and stuff, and then to take that extra amount of time out of your day, right? The seniors bus is great, but it is very limited, right? So, and then what do people who don't have access to that do? What happens when our doctor's office, which is right here, moves over to the hospital? Because that's going to be coming, right? We don't know when, but they've built a building, it's going to be coming. What happens when the doctor's office is over there and the lab, and now your recreation facility is over here? How do people access both of those, right? Like, these are things for the future. They're not necessarily concerns right at this moment, but things like to start thinking about planning definitely for too, right? So, right now we have a lot of good services that are kind of centralized in town, but when we spread them out, we're not really a walkable town, right? Like, I walked to the lodge to our seniors transportation meeting from West Haven School. It took me half an hour. And I'm a barely capable, able-bodied person, right? So think about a senior or someone like that who would have to walk that far. It would be hours, right? So there's just things we need to work on. So.
Yeah, so the overall goal was to successfully develop and implement a regional ATS service in a rural area of Alberta. So the vision statement for our group was West Yellowhead Region connects communities through transportation services for the well-being of all residents, supporting people's needs to access services. And the mission was that members of West Yellowhead Transportation Committee collaborate to develop and sustain an affordable and accessible transportation solution for our residents. So I think with the Sundog coordination and with our medical group promoting, and we now have these documents that we'll be able to hand out. I think it's a piece of the puzzle, but it's certainly not answering all the problems, right? And we've already gone through all of this. First mile, last mile. So that's basically where we're at right now. And as far as your involvement, it's somewhat wrapped up because it was a year. But at the same time, Bonnie still continues to provide us support, and their group has been really wonderful. Yeah. And so the next step that we're going to be doing in the community is on April 25th at 1 o'clock at the Healthcare Center or Hospital. We're going to be hosting an info session so that the general public, anyone who would like to come and attend, can come and learn about the service that is available. And that'll be on at 1 o'clock with refreshments on the 25th.
And if I can add to that, and I think one of the things that is important, particularly when an area starts developing an alternate transportation for seniors program, is that typically it starts off small. And again, I'll use Wainwright as an example, where they started off giving 20 rides a month, and they had a part-time paid driver. So I don't know of any community that looks at the transportation needs of their seniors and says, okay, we're going to implement this model, it's going to be the Cadillac model. And sometimes you have to start with the Volkswagen and then move up to the Chevy and build on it. And like I say, now with Wainwright, they have a full-time paid driver, a part-time driver, and they've added in volunteer drivers. And we know that they still have seniors in their community and in their area that have unmet transportation needs, but they have a lot of seniors that now have transportation that didn't have before. So it often is the case that you crawl, and then you start to walk a little bit, and after 10 years maybe you can run. But I think that the work that the decision that the working group has made in terms of the collaboration with Sundog to begin with, that infrastructure is in place, and they've come to the table and they're willing to work with the West Yellowhead group to enable the transportation mobility in the major centers. And you've identified the other forms of transportation. So I think just continuing the conversation and having your support to support them in terms of building the model over the years, because we know our seniors want to age in place, and the only way they can age in place is if they have transportation mobility.
All right, well, thank you very much, Bonnie, and thank you, Tanya, Maggie, and Sung Ho for your presentation, your work here today. So we'll open the floor to questions from council, and we'll start with Councillor Bevan.
Through the chair, thank you very much. And I know I've heard this quite a few times, that there is a gap between our busing in town and that. Not only they run from a Monday to a Friday, there's nothing on the weekends at all. And I know the seniors can't get out to either get to the pool or get downtown shopping or anything like that. You know, and I think, you know, we have a chance to work with our Seniors Transportation Society here to, you know, as council, to see what we can do to help them, and maybe what with Yellowhead County come on board maybe with us or something, or whatever to help with that. The other question is Sundog is going to put on a bus that is wheelchair capable, isn't it? Because I know I was talking to some of them here probably about a month ago. I was at a meeting, and they were asked about being able to put a bus on that was wheelchair capable, and they had said they were going to look at it. And then I was really surprised. They've had a lot of questions on it, a lot of calls on it, and they said they would seriously take a look at it and do it, because they are getting, you know, asked from all across the region here where they serve in that and stuff like that. And I thought that was, you know, very, very good with them doing that.
Through the chair, I know that the first time that we'd spoken about it, at this point, I don't think they were quite ready to do that, or even maybe switch one of their buses to make maybe 2 spots for chairs. They said that if they do that, it'll take, I forget if it was 6 or 8 chairs that they would have to take out. And right now, when they make their trips to the city, they're actually full a lot of the time. So, but at the same time, they're going to be putting questionnaires on their buses and for our patients and whatnot to fill out. And I think, like you had said, with anything, if the need is there, I could see them enhancing their service that way. But
you know, I think the need is there. I think, you know, they're getting a lot of questions on it. The person I talked to said they were getting a lot of questions on it and asked. You know, so I think it will be there, and I know people that do run it and that, and they're very good people, and I think they will eventually step up and be able to do something. And I think we can, as a region, can support it too, for sure.
All right, thank you, Councillor Bevan. Councillor Schnard.
Actually, thank you for your comments, because like where you keep referring back to Wainwright, well, Edson has been there. So we have, in Edson, we have an extremely good seniors transportation bus service, but I'm understanding the gap, because like where you're looking at, when you get to Edmonton, you have taxi services. So we either got to fill the gap through a private sector, meaning a taxi service, or the seniors bus. But I take it you have talked to the seniors transportation bus. Have you met with them and tried to get involvement?
Go ahead.
Yes, we did have a chance to meet with them and try to kind of connect the inter-community transportation and within community, intra-community transportation, so it's actually usable. There were a few barriers identified by the ESTS, and unfortunately, when we try to identify some solutions or the support that they need to make this model work, at the time there was little difficulties in understanding those models, how they can work together, and they were identifying that their current services can't be much expanded, and which the Sundog services is as good as it is. It is from Jasper to Edmonton, and it's intra-region services. So it is very hard for them to adjust their time schedule. The only way that we can actually accommodate is our time schedule need to be meeting their time schedule. But with the rigidity of current services, it was impossible for us to identify a solution at the moment. And like Tanya mentioned, they are having their own board meeting in a few days, and they said they wanted to discuss within their board meeting. I don't know. I believe that discussion has been happening in past as well, and it hasn't been resolved in a positive way to actually make this model work. So as a small group, we've been trying to brainstorm to find if there's any other, as Councilor mentioned, trying to identify some other private industry who can join and provide some services. So far, we haven't been successful to identify a good player that who can actually do that role yet. So we would have to continue our discussion and try to identify the further solutions in this matter.
Can I respond?
Yeah, go ahead.
Yes, you know, like what you're saying is what the town, and I mean, most of the public's not aware, the town of Edson does help them funding, and it has been. So I look forward to some positive interaction because they are in great shape with the amount of buses they have. I understand their struggles. You know, they're running a schedule of so many drivers, so I'm hoping we can have some kind of meeting with them to figure out how we can expand it, because there's no use duplicating. I see what you're asking for through Sundog Tours. We have the Jasper to Edmonton covered, but where I see where you're stumbling is mile 1 at each end. So if Edmonton's handled, so I'm hoping we get some kind of cooperation that it is possible that the bus can be set up through Sundog Tours. If they're arriving in Edson at 6:30-ish, then maybe we should have that bus, because I'm understanding the struggle of the seniors, that they lose their driver's license, they either can't afford or not aware, and you know, instead of duplicating, we need to move forward and saying we already have a great service, hoping through cooperation we can say, okay, if there's grant funding, etc., you know, they have 2 buses, if we buy a 3rd bus, put it on so you got 2 running, and through funding, granting, etc., that we can have the extra bus that would maybe cater more to doctors' appointments, like the one comment you said. And I know talking to seniors, they're more than patient to wait, but you know, a 20-minute doctor visit turns into 2.5 hours, not due to anything the seniors' bus is doing wrong, but we need to expand that service. So I look forward to some of the meetings.
And if I can,
Yes.
and as I understand it, and I understand Sundog's, their fixed route,
Yes.
and they have dedicated times, and they have to leave at those times
Mhm.
in order to drop the senior off in Edmonton at around 11 o'clock, and then they can access the specialist appointments. So their schedule, I suspect, as much as they would like to change it, they can't, just
Right.
because they would end up taking seniors getting into Edmonton at 2 o'clock, and how many seniors are going to be able to see get to their specialists for their appointments. So I think from my perspective, the little that or as I understand it, there needs to be more flexibility with the Edson or with the communities that are using Sundog to connect to get into the major center. They are going to have to be flexible because Sundog has to have that fixed route.
No,
That's,
okay,
gotta
go
move
ahead,
on.
and
So,
then I'll come back.
Councillor Sorensen.
I'm sorry, I made a great presentation, but I apologize if I missed it. Is there no provincial funding for medical transportation available?
There is, and it's through the Ministry of Seniors and Housing, but it's for low-income seniors. And there's, for their medical transportation, there is reimbursement, but there's a fixed kilometers, and I believe it has to be, you have to be further than 86 kilometers, 90 kilometers from your medical appointment before you can access that funding.
And I think you have to pay up front and then you're reimbursed,
Yeah.
right? So sometimes that's a bit of a barrier too.
But thank you for asking that, because there is funding available, and I'm not confident that all of the seniors that need to use that service know about it.
Right. Got a follow-up?
I'll
Use
let
that
someone
funding.
else and then I'll ask.
Okay. Go ahead, Councillor Brown.
Through the chair to administration. So what do we currently contribute to this program? I just see our name on the back of it here. As far as the cost of sending into Edmonton, what's our current, like, do we have a budget for it, or we just pay a certain amount of it, or?
Want me to respond to that? Okay, through the chair. At this point, it's completely funded by the individual. The town of Edson doesn't provide any money for someone to get on the Sundog. Is that what you mean?
Yes, yes.
Yeah,
Okay.
but just also an important piece is that if, for example, if someone in a wheelchair needed to rent a wheelchair accessible bus and get driven to the city and back, it's a $700 round trip. So it's very difficult to live out here if you have disabilities.
I think I would just add to that obviously the contribution of any town staff in organizing and facilitating the process, but there's no direct monetary contribution to the committee or the society.
And one follow-up.
Yes, please. Through the chair to Ms. Stotts, or maybe Tanya Byers. Do you know what the current hours of the seniors bus is in Edson?
Through the chair, it's my understanding they're about 8 to 4.
8 to 4, okay.
Yeah.
They wouldn't really give us like clear, like, what's your hours? How many, like how many runs do you do? Where do you pick up? Where do you drop off? Like, what are your most, like they just said they're very busy in the morning, and then they wouldn't elaborate on a lot of the information that we were trying to really gather out of them to essentially determine what the needs are in the community. So,
Okay, thank you. Councillor Curry.
Thanks for your presentation. Am I allowed 2 questions, Chair?
Yes.
Thank you. Through the chair, so other than the government, like the just reimbursing, there's no additional funding currently? And we don't have any subsidies within the community?
Through the chair, there are a few streams of funding through provincial grants, but there isn't a lot of funding for alternate transportation for seniors. There is the Community Initiative Fund, the CIP. There's funding available for purchase of vehicles, and in fact a lot of the handy vans that we have in our communities in Alberta have been financed through that program. But in terms of the actual delivery of service, there's no funding stream.
Okay, thank you. And then my other one, thank you, through the chair. For your event that you guys are having, just for advertising and such, who are you looking to have there? What's the kind of population you're wanting there? Are you wanting people with patients? What are you wanting?
Yeah, through the chair, I would like to see all of you there. I know this morning at Yellowhead County at their council meeting, there was a few that had indicated that they would be attending. We definitely want seniors to come, or family members of seniors. Really anyone, practitioners, anyone that would be able to pass the information on or come and learn about this service. Because it doesn't have to be a medical reason that you get on the Sundog. Sometimes a family just needs to get to the city to buy their school clothes or, you know, whatever the case may be. Anyone could take the Sundog. They just wouldn't get this $80 price because that's been medically at risk.
Can you send us this in a poster format?
Ally's actually made a poster. Yeah.
Perfect.
Yeah.
Thank you.
All right, thank you. Councillor Sorensen, do you have a follow-up question that you had?
Oh yeah. I was wondering, do you know if there's taxis available in Edson with wheelchair accessible?
Through the chair, there's no taxi available for wheelchair available at the moment, as far as I know.
So I was wondering if Sundog is arranging taxis at the other end, maybe we could bump this $80 up to $90 and then have the last mile handled as well by Sundog. But if there isn't a taxi that can handle a wheelchair, then that kind of negates the option.
All right, go ahead, Tanya.
Just one more thing through the chair. Really disappointed this morning. We didn't get the grant that I applied for through New Horizons. Can't believe I'm getting emotional, but we put a lot into it, and it would have made a big difference to this project if we'd have gotten it.
Okay, Councillor Chouinard.
Actually, one just closing just on response. I'm not faulting Sundog for like saying, you know, for people, like I appreciate the schedule, and if you are in Edmonton and you have to spend the day, that's kind of a fact of life, like even people driving in. So what I guess we have to concentrate, and on this meeting, hopefully we can get representation from the seniors transportation bus to go there. They'd be very strong, because Sundog would be like Greyhound, anyone. There is a set schedule, same as a train. So I guess what we need to work on our end in Edmonton is very accessible. You have a lot of special needs taxis and service because it's Edmonton. So what I'm personally looking at here, we have it. We just need to work with them. We have senior transportation bus. So we have something that can move them around. So I look forward to the meeting. And I guess our job, what you're asking, we're looking for seniors. As council, we probably have to meet with senior transportation bus and figure out what we can do to help them out. They are busy, they are struggling. I'm shocked with your comment because there used to be a schedule, you know, and I guess we'll have to do a follow-up with them and say there used to be a schedule that seniors could phone and say the bus runs from set hours. So I'm very discouraged that they're not disclosing the hours, because I think they need to pull up their socks and say, okay, if we're busy from 8 till 9, they need to disclose to you when making appointments. Our best time would be from 11 till 1. I'm just, you know, adversely picking numbers, so to help you with your cooperation, said, okay, when I'm setting up appointments, this is the bus schedule, same as going Sundog. So I think we need some more cooperation to make this work. So actually, I applaud the work you're doing. We have some more work to do, but I'm pretty sure we can make this happen. We just need cooperation of all parties involved.
Go ahead.
To the chair. Thank you very much for your comment. And then that was our intention when we met with the ESTS. And then exactly as Councillor Schneider suggested, 2 bus system and a third bus in place. And then they were having little difficulties initially because they were misunderstanding us, that asking them to do more work. But at the end, they wanted to discuss that exact matter with their own board. And then, like you said, if ESTS stood forward and then wanted to work with intercommunity transportation, that is the best solution. I 100% agree with your comments on that. So if ESTS could accommodate those services for those seniors who dropped off at 6:30 and who need to take on the bus at 8 in the morning, and if those things are available, that is the best solution. I agree with that.
All right, thank you. Councillor Blair.
Through the chair to, I'm not sure who can respond. So if the seniors bus can currently drop them off to the Best Western before they get picked up, and then they don't get back into town until 6:30 p.m. So how are they getting home? Like what does that last mile look like?
Right now
at
it's
this moment?
either friends or family or taxi service.
Okay.
And you know, when we talk about the cost of a taxi is $6 around one way for a senior,
Okay.
but the seniors bus is $3, right? So it's half the cost. And maybe to you or I that doesn't seem like a lot, but to someone who is on a very fixed income, that can be a lot of money, right? So,
Okay.
and especially if they have to then take that taxi also to go get groceries, go to the bank, go to the doctor's office, go to the pharmacy, right? Those sorts of things.
All right. Councilor Bella?
Through the chair, I can also see that now we're having our new lodge is going to be opening up here, and it is going to have more residents in there than we ever had before. It's going to be busier than that, and we're going to really need this service. So I'm glad you guys are bringing it to our attention now instead of later, and it gives us something to talk about at our maybe our retreat, doing stuff like this and throw stuff around and see what we can come up with and that. But it's going to get busier, for sure. Thank you.
All right, thank you. I haven't had a chance to ask any questions yet, so I'll step in now. Interesting that this presentation happened tonight, because I actually received a phone call from a senior yesterday morning talking about the seniors bus and how important it is in our community. We talked about some of the challenges that her and her friends have, and one of the things that I brought up was that we're having this presentation. This is something that we're looking at addressing, and she was very excited to see that work is being done. She has a friend that has dementia, and so I applaud you for the work you're doing, and trying to work with all the different agencies and making this happen. But I've got a question. You mentioned that patients sometimes don't show up to appointments because they can't afford to get to the appointment at the hospital. So if they can't afford a $6 trip to the hospital via taxi, how are they going to be able to afford an $80 trip if they have to go into the city? Is that a barrier, or is there, like, I know there was mention of grants maybe available for them to apply for?
Yes, it is a barrier. There is a very defined barrier. Like some of those clients, I mean, it was not only the $6 that was that I meant to say when I said they couldn't afford it, but they couldn't arrange their bus schedules, or they couldn't arrange anybody who can drop them off to the hospital, including all those difficulties. And also funding matters, like if they have absolute difficulties, like coming up with those fundings, so we do have a social worker who's working to get them get the funding, transportation, if it is absolutely necessary. So far, I think we've been patching up those needs by connecting them to the social workers. But some of them get the services, and many of them doesn't get the services. That's the reality at the moment.
Okay. And just a follow-up. I know that a number of seniors may be able to utilize the service and be fine with that, but I know that there's some that are struggling, that may have dementia, or they may have some other challenges, or they may need somebody to go with them. Is there any programs in place to help pay for that second individual who may need to accompany them to their appointment, or there's nothing available at this point in time?
There's no program at the moment.
But for the Sundog, doesn't the companion ride free?
Yes, they
Oh,
pay.
no, okay.
It says here the companion rides at the same fare as the
Okay, yeah.
person,
Same
fare.
so it is a reduced rate for
Okay.
someone who's.
There was a time when they did ride for free, but I think because we're cracking it open like
Yeah.
this, it'll be pretty tough to do.
Okay. And my final question is through to Tanya. I don't know if there's any room in our budget in order to maybe look at partial subsidization of a program like this. I know that we didn't expend some funds last year, so I don't know if you have any ideas in that regard that we can maybe contemplate as we look at this broader issue. I really believe this is an important thing that we need to address in the community.
Through the chair, I believe that, with the money that was placed in reserve, a decision, I guess, needs to be made about it. The one thing that I have thought about was having maybe taxi vouchers that they could come and purchase for $3, so we would subsidize them by $3, I guess, with some of that money. And, we would have a criteria in place, so maybe the same as the community volunteer income tax program, if you're eligible for that, and use those as the thresholds, that if you fall in that you could purchase those, much like our snow shoveling program.
Okay. All right. Thank you. I don't think we have any other questions. Thank you so much for, go ahead.
If I can,
Sure.
through you, Mr. Chair, I want to thank you so much. First off, you took time out of your day and scheduled this meeting at a time that was accommodating, and we really appreciate it. But I know all of the work that we've done over the years, the response that you have given the group has been just tremendous. So thank you for your support, and thank you for your concerns about seniors' transportation and mobility in your community.
All right, thank you, and safe travels home. All right, so we'll move on now. Questions from media and public regarding items from this council meeting.
I don't have any questions.
Never have any questions. All right, sounds good. Can I get a motion, please, for adjournment? Councillor Schnarr will make that motion. Non-debatable. All those in favor? Motion carried.